This is USVI News, your Virgin Islands connection.
Hi, everyone. Thanks so much for joining us for USVI News. I'm Emily Matson. Already, thousands of Virgin Islanders have cast their ballots in early voting in the primary election. Election Day is this Saturday, August 6th. Voting centers will be open from 7 o'clock in the morning until 7 p.m. Initial tallies show there were more than 3,800 people territory-wide who cast their votes early this week. The Elections Office is encouraging voters to familiarize themselves with the voting process before Election Day this Saturday. So for a list of candidates, sample ballots, and other election information, you can just go ahead and visit vivote.gov. All that information is there online. And there are many important races on this ballot this primary election. The biggest race, of course, is for governor of the U.S. Virgin Islands. Democrat incumbents Governor Albert Bryan Jr. and Lieutenant Governor Tregenza Roach are facing many challengers. They're listed on your screen. There are many other candidates running for Senate seats in the VI legislature and also open seats on the Board of Elections and the Board of Education. There are a total of 54,576 registered voters in the Virgin Islands. Meantime, Governor Bryan announced this week his administration's Healthier Horizon agenda, a plan to build a stronger healthcare system for Virgin Islanders, is going great. He highlighted the $10 million to both the territory's hospitals, which will help them modernize their medical systems and also help them recruit and retain medical staff, which is badly needed right now. He also talked about the success of last week's Digital Health Summit and the free diabetes health and wellness fair that provided free diabetes and blood pressure screenings, counseling, and eye and foot exams, funded by a $1 million grant from the Office of the Governor. And Bryan touted his proposed Behavioral Health Act, which was approved by the Senate Health Committee last week. He talked about the plans for the new Charles Harwood Medical Complex in St. Croix and also full approval from FEMA to completely rebuild the Roy Lester Schneider Hospital on St. Thomas. And this week, the Department of Health is hosting the Virgin Islands Health Disparities Leadership Conference on St. Croix. Governor Bryan says these initiatives are major steps toward enhancing and upgrading health care for Virgin Islanders.
All of these initiatives, along with others, are part of our work transform, are a part of our administration, continued work to transform healthcare in the territory and to encourage all Virgin Islanders to lead a healthier lifestyle. Speaking of healthier lifestyles, our Walkout Wednesday activities on all three islands have been a huge hit. If you haven't done it yet, every Wednesday we all take off all our suits, jackets, and shoes. We put on our gym clothes and we go walking. Now, I walked Frederickstead from Midre Cummins all the way to the pool and back. Last week I did St. Thomas from Griffith Park to Yacht Haven and back. Had a good stroll on that Veterans Drive, and it's becoming more popular. So we have 4 more, it's 6 weeks, every Wednesday. This week, it's going to be again on Wednesday at 5:30 at the meeting places. And also in St. John, they walk. I haven't done St. John yet, but St. John, I'm coming. It's not going to be this week, but I'm going to make it before the 6th week is out. We encourage everyone to visit our website, ourbestlifeusvi.com, for more information or to register for the walk and get your free T-shirt. So you go, you get a free T-shirt that says Our Best Life and a towel. So we're making all of these moves and push to, number one, keep people out of the hospital by getting them exercise, getting our parks up to par, our courts, tennis, basketball, fixing our ball fields, our lighting, creating walking spaces in our partnerships with AARP and the Walkability Project with Public Works, making sure that we have access to different types of health activities in the community, and then by putting all the resources in the departments of health, in our private sector, as well as our hospitals to make sure that we have a healthier horizon.
A number of cruise lines are dropping the requirement of a pre-cruise COVID test for vaccinated guests on shorter trips. In the coming days, Carnival Cruise Line, Royal Caribbean, and MSC Cruises will no longer require pre-cruise testing for vaccinated guests on trips of 5 nights or less. And Virgin Voyages, Asmara, and Margaritaville at Sea are dropping required pre-embarking testing. The changes come after the CDC ended its COVID-19 program for cruise ships last month. The CDC said cruise lines have the tools and guidance they need to manage their own COVID programs. In its latest guidance, the CDC said cruise lines should consider mandating COVID tests for travelers close to departure and highly recommends testing within a day of the start of the cruise. The Virgin Islands Department of Education is releasing new COVID-19 guidance for schools. As we've been reporting, these guidelines come just before school gets started again next week on Monday, August 8th. Masks are no longer required to be worn in school buildings. Also, mask testing isn't required to return to school after extended breaks. The Department of Education is still encouraging students, teachers, and staff to social distance while on school grounds. The Department of Health will do contact tracing for every positive case and says there is the potential and ability to test the entire school buildings if there is a COVID outbreak. And stay tuned to USVI News later this week. Governor Albert Bryan Jr. is holding a news conference Wednesday morning about the new school year. And the VI district is in line with most U.S. school districts when it comes to COVID rules, as many students are heading into the new school year with an optional masking policy. Recent data shows about 98% of the top 500 kindergarten through 12th grade schools do not require face coverings. However, the School Superintendents Association says policies could change in some areas where COVID-19 cases escalate. The CDC is recommending universal indoor masking for schools and early education programs in locations with a high COVID-19 community level. And right now, the CDC says nearly 46% of all U.S. counties fall in that category. And every child feels differently about going back to school. Some may be really excited, while others a bit nervous. And anxiety, certainly in children, may not look the same as it does in adults. So here are the signs to look out for and ways to help your child get ready to head back to school.
It's that time of year again, and heading back to the classroom may bring up a lot of different feelings.
Even if your kid is excited about going back to school, it's okay and completely normal if all of a sudden they start to feel anxiety.
Therapist Jody Baumstein says back-to-school anxiety can look different in every child, but some common signs to look out for are frequent worrying about school, trouble concentrating, frequent headaches or stomach aches with no known medical cause, changes in eating or sleeping habits, clinginess to caregivers, changes in mood, sweating, shaking, or fast breathing when thinking about school, and not taking part in activities they normally enjoy.
Anxiety can come from fear of the unknown. So for some kids, what's going to be most helpful is just really familiarizing them with certain things related to going to school.
Parents can help by going to the Meet the Teacher night or visiting the school before the first day. Drive the bus route or drop-off route with your child so they know what to expect. Encourage your child to practice with things they'll be using on their own, like lunch containers or backpacks, and meet up with other kids who go to the school so there are familiar faces.
Anything you can do to prepare ahead of time is going to put their mind at ease and make them a little more comfortable on day one.
And feelings about school may change day to day, so the therapist says it's important to set a regular routine where parents check in with children and ask open-ended questions to see how they're feeling. Well, if you think airplane seats are too small, this is your chance to speak your mind. The U.S. Congress is directing the FAA to establish minimum dimensions for airplane seats. It's not your imagination. Seats have gotten smaller over the years as airlines try to fit more passengers in their existing planes. After the years of inaction, though, the FAA has announced it will open a 90-day comment period to allow feedback on airplane seat size standards. It's a pressing issue for plus-size travelers, which goes well beyond comfort to being a safety issue when a plane has to be evacuated. The details about how the public can comment on airplane seat standards are expected to be published in next week's Federal Register. A popular sunscreen to prevent skin cancer may cause a cancer risk of its own. Banana Boat's hair and scalp sunscreen is being recalled after tests detected trace levels of the carcinogen benzene. The company, which makes the sunscreen, says the recall applies to 3 batches of their SPF 30 spray. The affected sunscreen lots have expiration dates of December 2022, February 2023, or April 2024. No other batches of hair and scalp sunscreen before or after those expiration dates listed are affected by the recall. The company is asking retailers and consumers to dispose of the product and contact them for a refund.